Tony LaRocco, Bridgeport, Connecticut.
Good to see you.
Good. When you talked about energy independence, I'm in agreement with everything you said, but I'd like to see at some point that any gas or oil taken off public lands that belong to the American people by legislation have to stay within the United States and not get mixed in and exported overseas. That will at least assure us of having a supply. Okay. Secondly, the Health Care Act. You stood here before and you talked about the things that are the three biggest contributors to the expense of the federal government is Medicare, I guess it's Medicaid,
Social Security, Defense,
Social
those are the big ones. Yeah.
Okay. I don't agree and I don't like the federal government taking over, okay, another system that is going to end up just like what you say we have a problem with now, Medicare, Social Security, systems that eventually went out of control. We talk about $50 billion a year in waste and fraud in Medicare. Here we take over 1/6 of the economy. I think everybody should have affordable health care, but why did it have to be done this way? What it looks like is another Ponzi scheme, another Bernie Madoff. You've got all these people at the bottom trying to take care of the people at the top. If the government had mandated the private sector to provide for catastrophic coverage, cover your kids till they're 26, portability, and whatever else is in the affordable health care, and let the private sector manage that, okay? They're going to look at expenses, they're going to keep the cost down, and the government, who is probably the most inefficient entity there is in this world, control that. Private sector, and you came from the private sector, and you know how that works. And the last point I want to make is make sure you tell your folks here what the difference between the national debt is and the deficit. Deficit coming down doesn't reduce the national debt. You're just adding a little less each year to the national debt.
Right.
And the CBO says in about 3 years, every tax dollar that is gotten from individual income taxes will only go to pay the interest alone, and nothing else on the national debt, unless we start cutting that down beside the deficit.
Thank you, Tony, for your comments. Very quickly, a couple of points, because I do want to take some more questions here. I've heard two people now object to exports of our energy, so I'm hearing you on that, and I appreciate that feedback. It'll be a while, I think, before we're voting on stuff related to it, but nonetheless, I appreciate the feedback. Back to the Affordable Care Act, I want to try to be straight with what is and is not happening here, and that's why I was fairly aggressive about explaining what a death panel was and what the IPAB was. I don't think it's quite right to call it, as Mr. McGuffey and as Tony, you did, a government takeover of healthcare. Hospitals are still private. The drug companies, all the pharmaceutical companies are as private as can be. Doctors are not working for the government. The private insurance companies, and by the way, my people in this room who are kind of more on the left wing of things are a little angry about this. The private insurance companies are still private. So,
and they're running the exchange.
There are government programs out there. Medicare is a single-payer government system. Now, it's not really a government system because, of course, you can go to a private doctor or a private hospital with Medicare. But I think it's a little bit much to say that it was a takeover, a government takeover of healthcare, because everybody's still working for themselves. The government just came in and set some rules to the insurance companies and said, hey, you can't charge a woman more than you can charge a man. And it also said, we didn't talk about this tonight, but it said you got to buy health insurance. Now, that troubles people. And I've talked to a lot of people about this. It troubles people. And you know what? It should trouble people. This is the United States. We don't like government mandates. I get that. But here's the thing about the individual mandate, which, sorry, you didn't bring up. But even that, okay, government oversight. Everybody has to buy insurance. Why is the government telling me I have to buy this product? Here's why. Because we are a decent people. And if somebody shows up in our emergency room, we treat them. If somebody is bleeding, we treat them. So as a result, if I'm a 22-year-old invincible, they call them, I guess I was one once. If I was a 22-year-old invincible and I say I would rather go out and buy that widescreen TV than buy health insurance, and I get hit by a bus, as 22-year-old invincibles will every once in a while, and I show up in an emergency room, the decision I have taken economically there is I have said I would like to have a TV, and I would like all of you to pay for me when I show up in an emergency room.
Exactly, that's what happens.
So I get it. An individual mandate is an uncomfortable thing, but understand that if we don't have a mandate and all the young people get to make you pay for their health insurance or their health costs, that's a little trouble. Third point on the debt and the deficit. Absolutely right. We've got to be real clear about this. The deficit is whether we make ends meet in any given year. And we haven't made ends meet in any given year in this country except for a year or two in the mid-90s. So every time we run a deficit, we do add to the debt, which today stands at $17 trillion. And we got to do something about that. As I said, I think I was pretty clear about this, we have a little bit more work to do in terms of getting our budget into balance and in dealing with, as you pointed out, sir, 4 or 5 years from now, we start to see those numbers climb again, and that's something that has got to be averted. Thank you.